Yeah, welcome to Sonography Arena once again. In this video, we are going to learn about inguinal hernia and how to differentiate direct from indirect inguinal hernia. A lot of people find it difficult to differentiate these two forms of inguinal hernia on ultrasound, but it's a very simple thing to do on ultrasound. All you have to do is to follow this simple method I'm about to show you in this video. Before we go into the ultrasound images, let's quickly do a brief anatomy review. Inguinal region or the iliac region is a junctional area between the thigh and the lower abdomen. In this region, there is a inguinal canal. Inguinal canal is a conduit located in the anterior abdominal wall muscle, which converts the spermatic cord in male and the Van ligament of uterus in female. Also in this region is the inguinal ligament, which is a band of tissue that runs from the anterior superior iliac span to the pubic tubercle. Each end of inguinal canal has an opening. We have the internal opening, which is the internal inguinal ring or the deep inguinal ring, which is where the spermatic cord or the right ligament of the uterus enters the inguinal canal from the peritoneal cavity. We also have the superficial opening, which we call the superficial inguinal ring or the external inguinal ring, where the spermatic cord or right ligament exits the inguinal canal. Hexaback triangle is a weak area in the anterior abdominal wall, which is bounded by the inferior epigastric artery, the rectus abdominis, and the inguinal ligament. Let's now talk about indirect inguinal hernia. Indirect inguinal hernia is the most common type of inguinal hernia. It is seen mostly in the younger patient. It's a type of hernia which occur when the abdominal viscera, which could be the intestine, the mesenteric fat, or any other abdominal viscera, migrate through the deep inguinal ring into the inguinal canal. Now, when these visceral organs enter the inguinal canal, it can either stop inside the inguinal ring or move directly into the scrotum. Now, let's take a good look at how indirect inguinal hernia will appear in an ultrasound. Please, you need to pay very good attention here. One important landmark that you have to look out for in ultrasound when you are suspecting indirect inguinal hernia is the location of the hernia in relation to the inferior epigastric artery. In this video, you can see the hernia. This is the hernia neck right here, and then this is the inferior epigastric artery that's highlighted on the color box. In a indirect inguinal hernia, the herniation occur lateral to the inferior epigastric artery. Okay, I said lateral to the inferior epigastric artery. This is also an image of indirect inguinal hernia. In this case, you can see the intestine which has migrated into the scrotum. This is a very important point to note because in indirect inguinal hernia, indirect inguinal hernia has a greater propensity to migrate into the scrotum compared to the direct inguinal hernia. So most cases of direct inguinal hernia often appear as a bulge in the crown region without migrating into the scrotum. So indirect inguinal hernia has a greater propensity to migrate into the scrotum compared to the direct inguinal hernia. Another important feature of indirect inguinal hernia is the diameter of the hernia neck. In indirect inguinal hernia, the hernia neck is always narrow compared to the direct inguinal hernia, which has a wider neck. So this makes the indirect inguinal hernia more prone to complications such as strangulation and incarceration. If you want to know what incarcerated inguinal hernia looks like in ultrasound, go ahead and watch our previous video. I will paste the link in our description. Now let's talk about direct inguinal hernia. Direct inguinal hernia is common in older patients. This is as a result of a weakness of the abdominal wall, which is associated with aging. Direct inguinal hernia is less common in female because of the presence of a round ligament, which help to reinforce the inguinal canal. Direct inguinal hernia occur as a result of defects in the posterior wall of inguinal canal. This usually happens within the Hexabach triangle. As we mentioned before, Hexabach triangle is a weak triangular space in the anterior abdominal wall. So being a weak zone in the anterior abdominal wall, it is easy for a herniation to occur at this region. How do we now identify direct inguinal hernia in ultrasound? Okay, it is simple. All we have to do is to follow the landmark, which is the inferior epigastric vessel. In a direct inguinal hernia, the herniation happens medial to the inferior epigastric vessel, as highlighted on the color box on the video. And this is the hernia and then the inferior epigastric vessel, medial to the inferior epigastric vessel. That is where direct inguinal hernia usually happen. Another important feature is the diameter of the hernia neck. In a direct inguinal hernia, the diameter of the hernia neck usually appear wider compared to the indirect inguinal hernia. Just like you can see from this video, the diameter of this hernia neck is wider compared to the indirect inguinal hernia that we have seen. Direct inguinal hernia is usually reproducible. Cases of complications such as incarceration or strangulation are rare in the case of direct inguinal hernia. You can see the bowels, intestine in the hernia sac, they are freely moving. So in most cases, you have to ask the patient to be in a right position or do fast-over maneuvering for you to be able to appreciate the hernia on ultrasound. In summary, in a direct inguinal hernia, the sac protrudes directly through the posterior wall of the inguinal canal, medial to the inferior epigastric vessel. On the other hand, an indirect inguinal hernia follows the inguinal canal lateral to the inferior epigastric vessels. Secondly, the diameter of hernia neck in direct inguinal hernia is wider compared to indirect inguinal hernia, which often appear narrower. Thank you for watching this video. We do hope you find this video useful and you can now confidently differentiate between direct and indirect inguinal hernia. Please like, share, and subscribe for more guides and tips on ultrasound. Thank you for watching once again, and don't forget to drop your comments, questions, and contribution.